Welcome to consumer-driven healthcare or customer-driven healthcare. This is Consumer's Doctor on the behalf of Foremost Organization. We have been talking lately about this is a health financing segment. How to finance the healthcare. So when you finance the healthcare, like getting an insurance, we need to know there are certain things we have to go by. We talked about cost of care, the access of care. Let's talk about quality of care. When you get your insurance, so-called when you finance it through an insurance, we need to know the quality of care, which is the best model. Is personalized healthcare or customer-driven healthcare? Does it meet the criteria? That's what we need to talk about. This is an ongoing discussion about bottom-up approach for the customers, how to get the best care at affordable price. The cost is very important to the customers. Cost and quality and access. There are three, it's like a triangle. Cost, quality, and access. And customer is right in the middle. They want to have the best quality care. So let's talk about quality of care. Focus on quality of care today. Quality of care is only possible when options to access care is provided through an affordable health insurance. Affordable health insurance. Quality of care starts with quality health insurance. It makes common sense. It is a common sense. So quality of care starts with quality of health insurance. Personalized health insurance means easier access to quality care. It's like a triangle, folks. It is just one. You need to have a cost, quality, and access. We need all three for the best care. For the customers, easier access to quality care means better treatments. Better treatments is better health. This is the focus of Consumer's Doctor on behalf of Foremost Organization. We'll make every effort to focus on customer. They have been ignored for too long. Consumers have been ignored. When you talk about healthcare, consumers have been ignored all the way through. We never had a consumers-driven healthcare or customer-driven healthcare. People say, "Oh, we had a private insurance, it didn't work, and now we have Obamacare." That's how, Obamacare came in because of too many uninsured. That's how Obamacare came in. But we never tried bottom-up approach where customers, all this time, insurers were in the driver's seat. They were dictating the terms. They were telling us what to do. But I want the customers to be in the front line, consumers to be in the front line. So Institute of Medicine concluded health insurance is associated with better health outcomes for adults with their receipt of appropriate care across a range of preventive, chronic, and acute services, folks. Yes. Preventive, chronic, and acute services. Adults without health insurance experience greater declines in health status, die sooner than do adults with continuous coverage. That's a fact. We all know that. That's a fact. But I don't know if the top-down approach or single payer will address that. I don't think so. I really don't think so, because they have seen it in other countries, like in England and Canada. That's not the best. They don't rank the number one in the world. They don't. They're not number one, folks. We talk about the best. We want the best for the country, not mediocre. Americans don't tolerate the mediocrity. Mediocrity, they just don't tolerate. I know the Americans very well. They want the best. What is the best? We have been talking about personalized healthcare, where the customer or consumers are in the driver's seat. That is the best approach. And they demand the best quality care at affordable price, folks. I have no doubt they demand. It's not like, and Americans always wins. When they demand, they always look at what we have in the retail sector. Look at what we have in the other sectors. We need to learn from those other sectors, man. We have to learn from the other. Look at where we are especially the retail sector. Look at Amazon. Look at, Walmarts. Look at other companies where retail sector, online, especially online, they've been dominating. And healthcare is going that route, folks. You want it or not, healthcare is going that route. That's the way it's going to be. The ripple effects of being uninsured, having poor health, are felt throughout the society. Uninsured children have impaired development and poor school performance. Uninsured children are 70% more likely to go without care for common childhood conditions such as asthma, ear infections, sore throat. Uninsured children are 5 times more likely to have an unmet need for medical care each year. So there are consequences of either. If the single payer will solve the issue, I doubt it. Single payer, top-down approach will not solve. We need to have consumer or customer. They need to demand it. It's not, they've been demanding, Americans have been demanding it, but the representatives in Washington, they're not listening. They're not. How did the when uninsured went up because the insurance company started denying the claims. That's why the uninsured group went up to 27 million before Obamacare kicked in. What Obama did, basing on the need, he went ahead and passed the legislation with a one dead man vote. in the Senate. That was President Kennedy. Look at where we are. Obamacare, as a result, they raised the premiums on other average folks. They basically, it is affecting all Americans because of the premiums continue to rise in the private market, because anytime the government subsidizes, it has effects on the private markets. So uninsured are 33% less likely to get routine physical exams and 25% less likely to visit a doctor for illness. This is what happened before Obamacare. And uninsured women are 30% less likely to get a pap smear and 60% less likely to get a mammogram. Yes, and uninsured men 40% less likely to get a prostate examination. We need to give the tools for the consumers so they can be physically fit, but at the same time, they need to have an access to the health care. If uninsured adults have more absences from work, more unscheduled sick days, so-called sick days, and greater rates of disability. You know what? Kaiser Family Foundation in 2004 studied and found the society cost of the uninsured to be $125 billion, folks. $125 billion. There are consequences. There are consequences of the country having uninsured. Personalized health insurance provides specialized treatments for those most in need and improved access to quality of care for all who seek it, irrespective of their socio-economic status. That's what it does. Irrespective of socio-economic, people can't afford the premium, they will be looked into, they will be given certificate of guaranteed coverage, especially for the people who are impaired and disabled. They are the one we need to focus the attention. So that's where the quality of care kicks in. Quality of care includes good mental health for individuals and smaller groups. In 2008, mental health parity and addiction Equity Act, so-called MHPAEA. These abbreviations come out. That's how they make it look a little more complicated. Every time they come with abbreviations, it gets complicated. It's basically a study, folks. It's an act. Mental Health Parity Addiction Equity Act, which was passed by the Congress in 2008, required employers with over 50 employees to cover mental health the same as a physical health. Yes, that's what mental health is, same as a physical health. Employees, family members, enroll in small group plans need the same integrated mental health benefits. So the smaller groups should have the access to these larger employer groups. They should form so-called, all the smaller groups can coalesce together and have the access like a large employer, like over 50 employer. Like that's where the federal law kicks in. But smaller employer groups under 50 should have the access, same access like the larger employer group, as specified in the ERISA. So the Parity Act should be accessible to all the groups, including the individuals, self-employed. One truism exists. One truism exists. If an employer-sponsored plan does not include stress management, you can be 100% certain plan members will have their own stress management program. Yes, they will. They will. It is unlikely to be beneficial to a worker's health or productivity. Yes. Without a structured stress management program, the most common self-destructive, self-stress reliefs are, you know what the stress reliefs are? You'll be surprised. Stress reliefs are comfort foods. Comfort foods, smoking, alcohol, drugs. These are all comforts. When people get stressed out, that's what they do. They get into munching, wrong foods, alcohol, drug addictions, smoking. Those are the things. Those are the things. What happens when people get stressed out? They are the comforts people seek. Most employers are beginning to understand the work efforts of stress and depression. Yes, they are. Few employers fully grasp the debilitating impact on families from ADD, attention deficit disorder, PTSD, post-traumatic stress disorder, and other more complex mental health diagnoses. The mental health, physical health, corporate costs, they're all interrelated, folks. They're all interrelated. Let me repeat again. Mental health, physical health, and corporate costs are all interrelated. There's no doubt about it. Corporate productivity loses more. Their losses are potentially much higher than the treatment costs. This is where we can be proactive. Let me give you a scenario. The low cost for simple illnesses like frustration, anxiety, low stress, minor depression will lead to, these are minor illnesses which will lead to tobacco use, sleeplessness, cold, flu, and blood pressure. Ultimately results in increased errors at work, loss of teaming. People don't team. They loses the team effort in a company. What are the medium costs? For a company, moderate stress depression, anger, attention deficit disorder, post-traumatic stress, as I said, ADD and PTSD, which will lead to hypertension, musculoskeletal problems, digestive, gastrointestinal problems in the working class. That will lead to absences, poor morale, relation conflicts, loss of productivity. Those are the medium costs for these companies, folks. What are the high costs for the company? High costs when you have high stress, major depression, schizophrenia, bipolar disorder, obsessive compulsive neurosis, panic disorder. These are the example, folks. Anorexia, bulimia, which will lead to cardiovascular health conditions, cancer, diabetes, asthma, back pain, alcoholism, which will result in low productivity, divorce, turnovers, early retirement. People go for early retirement because of the stress. Claim workman's comp, disability. These are the things which are really, the costs are high for the companies. It costs very high. If you have had a treatment, it's a lot less expensive. When you have extremely high costs, or when people are violent and they are suicidal, that can result in accidents, burns, which can cause death, work violence, and disaster recovery, folks. There are extremely high costs. So mental health issue are not a character weakness, folks. It is not a character weakness. Like most physical illnesses, mental health is a disease and it's treatable. That's the beauty. And it is telehealth. With the telehealth nowadays, with telemedicine, these people can be easily be treated, monitored, create some type of a connection. As the Mental Health of America axiom states, you cannot have health without a mental health. That's what it is. That's what it is. In personalized healthcare, quality of care is passed with the A plus in personalized, where it is consumer or customer driven, and including quality insurance programs that will, the quality of care which customers received is A plus. You cannot have access to quality of care without access to basic principle, affordable health insurance, which has to be customer driven, access to good health insurance that meets the unique needs of individuals will provide a personalized quality of care. Yes. Remember, quality of care goes beyond provider credentials and medical results. It encompasses timely medical advice, informed options, alternative treatments, and good bedside manners, and more. So quality of care passed under the personalized health insurance with flying colors, there's no doubt. We need to approach from the bottom up, not the top down. Why would we embrace Medicare for all when Medicare itself is being broke? Medicare funds are dwindling. Why would we embrace that? I'm not sure. I'm not sure if that's the right way to go. This so-called Obamacare, it has nothing to do with healthcare, folks. People keep saying, oh, the Obamacare did such a wonderful job. But It punished the people who had the private health insurance. It punished the people who were healthy. It punished the people who were paying for the insurance. It punished those common majority of the Americans because it's a premium based system, folks. It is not based on healthcare needs of all Americans. Healthcare needs of all Americans are different. It needs to be segmented. It needs to be segmented into different There are majority of the Americans are healthy. Why do you want to punish the healthy folks? And they need to have a lower premium, and they need to be categorized into well category. They should have a lower premium, irrespective of what this lobbyist says. They need to be categorized as healthy, and you, customer, is the only one who can demand the lower care. Customer is the only one who can demand. And when you have at-risk category, when you have at-risk or acute conditions, like when you have people who smoke, they're prone for pneumonias. People with high blood pressure, they're prone for strokes. People with hypertension, high blood pressure, they can lead to heart failure. So at-risk group, they need to have a different premium. And why don't you categorize those group of people and provide the lowest premium and be proactive and give them online support? These are the people they need to be proactive. You can lower the premium if they follow. You incentivize the Americans. If you incentivize the Americans by savings, by not spending from their pocket, they will be, I can guarantee Americans will embrace it, and the premiums will be lower in the at-risk group. And there are only 16% of the Americans have chronic problems, folks. Only 16%. But you are punishing the majority of the Americans. 16% need to be categorized separately. They need to, even though 16%, if you focus and give them the incentives and rewards, their premiums will be lower too. And they need to be segmented. Those people with chronic illness category, they need to be segmented. And these insurance lobbyists are, brainwashing these people in Congress. They basically pumping the money. So they don't want to segment these guys. People under the chronic illness category, they need to be segmented. They need to have a lower premium. They need to be taken care of. They cannot be ignored. By giving them Medicaid or Medi-Cal, you're basically ignoring, because you know what? Providers are not accepting Medicaid and Medi-Cal. They will not accept. If the government tries to impose on them, they will not accept. If government tries to say, we're going to lower your payments to the providers, they will not take it. The same thing is happening in Medicare. As the Medicare payments keep going down, physicians are not enrolling into Medicare. They don't want to accept Medicare patients because they have been lowering the payments over the years. And government cannot dictate the doctors. They cannot dictate the physicians how much they will pay. And physicians will never go for it. I can bet you most of the physicians will just not accept it. They will go with a concierge medicine. They will go with concierge medicine. They'll be better off in concierge healthcare. Physicians, when the government keeps, clamping down on the payments to the doctors and all the providers like rehab, you name it, all the facilities, they will not accept Medicare. They will not. I can bet you on it. Because the payments I've seen over the years, I've been in healthcare for 40 years. Their payments are dwindling, folks. It is not the same like what it used to be. They're not paying much to the doctors. Medicaid is a disaster. Medi-Cal, Medicaid, state-funded, it's a disaster. These are the folks they need personalized health insurance. These are the people we need to focus the attention on. And people in the catastrophic category is only 1%, folks. They have 15% of the claims. We can work on people the customers will probably get a limited catastrophic coverage for a limited time, and they will pay for the premium because their premiums can be lowered, because once the customer is in charge, he will decide what is catastrophic and when to get the coverage and till what time. So they will get the premiums based on the category. So we need to have the risk, unlike Obamacare, which is one single risk, which will never work. You cannot have a single risk. Why should I be paying for somebody else's health problems? That's what I don't get it. I don't want to pay for somebody else's obesity. I don't want to pay for somebody else's hypertension. I don't want to pay for somebody else's mental illness. Why? As an American, I hate somebody telling me I should pay for the rest of the country. That's idiotic to say the least. Why should I be covering for the rest of the folks when I can get my own? That's so idiotic. You cannot have a risk pool based on single risk pool. You can't do that. That needs to be gone, folks. Only consumers, the customers in the front line, will demand premiums based on their risks. They will demand it no matter what anybody says. Whatever Washington does, they will demand lower premiums. Customers will demand. They will take control. They will get the best care possible, what they can afford. It has to be segmented, folks. You cannot have a single risk pool and destroy the country. We are spending $3.7 trillion. It has surpassed the national defense budget. When are we going to learn this lesson? When are we going to learn it? America spends more money on healthcare than the national defense. That's a joke. We can't do that. The only way it can be done, follow the example of other sectors in the country. Other sectors. Look at the retail. Consumers are happy. Americans are happy. Follow the same. Look at the groceries and food chains. Why can't it follow? Why is it so different from the groceries and food chains? Now, people are growing their own vegetables through aquaponics, hydroponics. Consumers will demand. Consumers are smarter than what the government thinks. Consumers are smarter. They grow their own way. Tomorrow, consumers will take charge of their own health. They don't need to be told what to do and where to go. And you cannot see this doctor. You cannot go to this place. You can't do that in healthcare. You just can't. That needs to be changed. Americans want total freedom in healthcare, like what we have in the other sectors. They believe in total freedom. They don't want to be told. They don't want to be told to have co-pays, deductibles, denials. Pre-existing condition, pre-existing illnesses is a facade. It's a facade. There's no. If the consumers are in the driver's seat, there's no pre-existing. They will get the insurance what they deserve, what they need. Every time you talk to politicians, we have comprehensive solution. That's what they say, comprehensive solution. Give the consumers, customers what they need. Give them what they need. Give them the tools. Invest in the folks, Americans. You know, Congress, you know, they send a check for $600. It's a joke. They're not asking, they're not begging for $600. How stupid. And they're wasting the money everywhere else. They're wasting the money. Kennedy Center. No, how often people go to Kennedy Center when you have a pandemic? You want to waste money on the other projects and other countries when people are suffering. I just can't. It's broke, folks. It is totally broke. Congress is not working for the people. Congress are basically, I don't know whom they're working for. They're not working for you, man. They're not working for Americans. They're not. Their salaries needs to be taken away. Their privileges. The other thing, what I noticed, once you become a congressman, your pension, all this, it's becoming like a a privilege because they keep getting reelected. They need to have a term limits. You cannot make it as a. And some of these folks, they haven't created a damn job. How many people have created jobs? These so-called congressmen, some of them they have no idea what a small business is all about. They have no idea because they're dependent on Washington. When you have a small business, people are suffering in small business in this pandemic. I don't think the Congress realizes that. Anyway, when I get emotional, I get carried away, folks. I'm sorry. I know. This is what bugs me the most. When you elect people, they're not working for you. Their interests are somewhere else. And you're paying them. When they stop paying, when we stop getting what we need, we should stop giving holding their salaries too, because that's a good thing, because we need to save money. Washington is broke, $25 trillion. Where are we going to get the money? Anyway, thank you for listening, folks. Thank you for listening. This is Consumers Doctor. On the behalf of Foremost Organization, we take every pride and effort where we want Americans to be totally free. We want American customer or consumer to be in the front line in this battle of healthcare, which we will see what President Biden does. If he does things which Americans don't like it, it's a matter of time, folks. If you do like this channel, subscribe, share, and hit that bell. We will see you in the next episode. Salute.